Hello, everyone. This is Doug Nelson with Precision Neuromuscular Therapy, and thank you so much for your interest in precision neuromuscular therapy for the cervical spine or precision neuromuscular therapy for the head and neck. In this little video, what I'd like to do is go over some of the pertinent anatomy that you will need that will make your experience at the seminar a little bit deeper and a little bit richer, having gone through some of that before you get to class, if you can. So, the first thing, just about the neck itself, it's a thing of architectural beauty. And like all very complex things, it's amazing when it works and disastrous when it doesn't. The complexity is a bit overwhelming, and that's one of the things that we need to be a little careful with in the seminar, because it's a lot of information in a very small area. So also when you attend the class, it's one of the reasons we tend to have very small classes, because what we want is your experience needs to be very focused. We don't want you over treating these muscles, because it's not a lot of real estate compared to some of the work that we do in the low back and the hips and legs and that sort of thing. So it needs to be incredibly thoughtful, yet incredibly thorough. And the neck is such an amazing structure in that, in some ways, for instance, if you look at each different layer often does different things. They share jobs, but they also have, in some cases, they work for opposite teams, like the splenius and the semispinalis. There are some jobs that it shares. There are some ways, for instance, in rotation, where these two muscles do exactly the opposite thing. So just dealing with somebody who has a very specific outcome that you're trying to attain, like they have restricted rotation to the left, just gliding up the neck is probably not the most efficient solution to get that done. You need to know all the muscles that are involved in that restriction, and therefore how to proceed and target exactly the muscles you need to. And in that's really what, in this seminar, that's what we're going to focus on. We'll do a range of motion assessment, because that's one of the most common things that people present with, especially in rotation. These kinds of limitations are things that affect daily life and function, and those are the things that tend to bring people in. And also symptoms like headaches and just regional pain in the neck itself. So we'll go through a very precise range of motion assessment, then do a really careful, really thoughtful, really thorough palpation strategies for all these different muscles, in the goal of you feeling really confident and really competent in being able to recreate that once you leave the seminar. Also, symptom recreation is a big thing for us. If the client says, when I turn my head to the left, this is what I feel, we want to look at things that recreate those symptoms, or put them in positions, or have them do certain activities where it helps us target the muscles we need to address. All that's in an effort to use the right approach for the right reason, in the right way, and in the right time. So we're looking at, is this muscular? Is there some specific muscle that has a strain, or is it a restriction in range? Is it some sort of referred pain phenomena? And in the neck, there's quite a bit of this. And there are several cases where the discomfort people feel is more joint related. And there are lots of soft tissue strategies that can be really helpful for joint related pain, but they have to be very targeted to be able to be successful. I love this study. I know this was 1989, this was a long time ago, but I would posit that in a way probably not much has changed. And in Switzerland, what they did is they did a review of over 11,000 patients with neck pain. 87.5% were found to have soft tissue pain as the source of their neck pain. When you think about that, from all the other choices available, from joint issues to arthritic issues to whatever, the 87% of them were found to have soft tissue pain, speaks to how important the kind of work that we do that is very targeted and addresses soft tissue pain in a way that honestly no other profession does, with the kind of specificity and with the very precise hands-on approach to be able to deal with it. So reviewing the anatomy, It's easy to overlook the platysma, but in the seminar, we're going to spend a little bit of time with it. And honestly, it's a muscle that's easy to overlook, but can play a big player, especially in restriction of extension in the neck. So just review a little bit with that. And to that same effect, at least spend just a little bit of time reviewing the hyoid muscles. Don't get lost in this because we're not going to spend very much time with this, but I think it gives you a perspective, especially when we start working in deeper layers in the front of the neck. And speaking of those deeper layers, there are things like the longus colli that has 3 different sections to it: a vertical section, a superior oblique, and an inferior oblique section. And then, of course, we have the scalenes. All of the 3 scalenes we'll also be addressing, including some work with the longus capitis. So familiarize yourself, especially with these anterior muscles, because for most people, that's an area that people haven't covered a lot in the past. And I think the clearer you are with the anatomy, the clearer you will be with your palpation. Also in the front, I think everybody's very, very familiar with the sternocleidomastoid. I think you're going to find some of the information and strategies that we'll present with this really interesting, really useful, and maybe things you weren't familiar with. So be clear about the SCM, and we'll go over many of the reasons and approaches to that in the seminar itself. Again, with the scalenes, familiarize yourself with all 3 scalenes. And again, we'll go over some of the applications for this in terms of especially neural things and thoracic outlet syndrome. Always good to, I think most people are very, very familiar with the upper and middle trapezius, but if you're not, review some of those things. I think you're going to love some of the different approaches that we'll do for this. And with the levator, I wanted to show you this view because this is one that people seldom see. We always see levator looking from the back, but look at the orientation of this, looking straight from above. Look how anterior this is oriented, which shows you a little bit of how that muscle is ideally positioned to stop any forward motion of the head, whether that's in an accident or whether that's in something that's static, like a chronic forward head posture. The posterior muscles of the neck certainly start with the splenius capitis and splenius cervicis, the capitis here and the cervicis. Understand where it attaches, where its superior and inferior attachments are, and we'll go through the palpation again at the seminar. And here's another picture of that that gives you a perspective, its relationship with the levator. And the semispinalis is one that people are a little bit less familiar with, but actually in the neck, really the semispinalis is like the erector spinae of the neck. So here's the semispinalis capitis, and this is the semispinalis cervicis. Big player in rotational issues, big player. So be clear about the anatomy with that. Here's a tight shot of the semispinalis capitis, and also here's the greater occipital nerve traversing through the muscle, which is true in a large percentage of people. So this is not something that you're going to just, take your thumb and just wail on this tissue, because you would be getting on people's nerves in a very real way, actually. So we'll show you how to carefully and thoughtfully deal with this if, in fact, the person has symptoms of greater occipital nerve sensitivity. And that's not terribly uncommon. And here again are the suboccipital muscles. So the rectus capitis posterior minor and the rectus capitis posterior major. If you're interested in this, definitely go and take our online course on the suboccipital muscles and headaches. I think you're going to love some of the research studies, which are primarily about this little guy. And oh my goodness, is it fascinating, the neurological and functional implications of this one muscle. Absolutely fascinating. And then this is the obliquus capitis inferior. We won't spend much time with the superior, but rectus capitis posterior minor and then the major, and the obliquus capitis inferior. Make sure you're familiar with those muscles. And here again is a muscle that not many people are familiar with, which is the iliocostalis cervicis. We find it in the clinic a very important muscle to address, and often is responsible for pain that goes to like underneath the mastoid. Very interesting. And then on this side, it's a little tough to discern this, but this is the longissimus cervicis. So, and here's another picture of the semispinalis and the semispinalis capitis. So again, review these muscles. The clearer you are with that, the clearer you'll be with your palpation skills. And in the seminar, we'll help you understand the why behind the what. That's the most important thing. That for everything you do, there's a clear why behind it. That's really the heart and soul of precision neuromuscular therapy. Thank you so much for taking the time to watch this, and we really look forward to having you in one of the precision neuromuscular therapy seminars. Thank you so much.